At CAHR 2024 in London, Ontario, I was grateful to present the PLDI abstract titled Advancing Inclusion and Cultural Safety in HIV Leadership Training, a comprehensive evaluation by peer evaluators. Let's look at the background and context, methodology, results and recommendations, and future work and next steps. Starting with background and context is a good reminder of definitions. Inclusion can simply be about people feeling a part of something, like they belong in the room. Cultural safety is an approach that originated in the healthcare field, particularly within Indigenous contexts in New Zealand and Australia, but has since been adopted and adapted into various settings. Individuals feel respected, safe, and valued regardless of their cultural background. What was evaluated for inclusivity and cultural safety? It was the Positive Leadership Development Institute trainings. PLDI offers 3 training modules: a core training, communications, and governance training. It's a program for people living with HIV to discover and develop who they are as leaders. In the past 15 years, over 1,000 people have graduated from the program. PLDI is a national alliance funded by the Public Health Agency of Canada and is delivered by 3 provincially focused organizations: Ontario AIDS Network, COHR in Quebec, and PAN in BC. Why was PLDI evaluated? Inclusion and cultural safety align with PLDI values, with a commitment to truth and reconciliation. We want to have a better understanding of African, Caribbean, and Black community members, and overall contribute to better health outcomes for all people living with HIV. Who performed the evaluation? There were 20 peer evaluators, 14 of which belong to the ACB community and 6 Indigenous people. Listed here are some of the peer evaluators who still serve as Community Advisory Committee members who have a desire to continue this work. Some other people provided backbone support, and we would like to thank Gilead Sciences for their financial support. Where did the evaluation take place? The peer evaluators participated in 8 PLDI trainings as the main evaluation setting. The trainings either took place online or in person. Online trainings comprised of 3 standard core trainings and 3 governance. And in-person trainings consisted of 1 specialized core that took place in Saskatchewan and 1 communications training in Quebec. In total, this yielded 30 evaluations from the peers. Across 18 months, most of the evaluation was performed between winter of 2022 and October 2023. Now on to how the evaluation was conducted. Participatory evaluation was the central project method. It was about actively involving Indigenous and ACB people living with HIV. The approach emphasizes collaboration and shared decision-making to ensure that the evaluation was relevant to the perspectives of the communities the peer evaluators belong to. 3 methods were used to gather peer evaluator feedback as data about the trainings. First, peer evaluators provided feedback on trainings by answering questions in an evaluation manual as they were experiencing a training in real time. Second, focus groups with the evaluators provided opportunity to share more nuanced information about whether the training environment was a positive experience, felt safe, acknowledged culture, and was delivered respectfully. Third, they participated in a standard post-training evaluation survey that all participants complete at the very end of a training module, which measures the quality of various aspects of any given PLDI training module. The research methods included a mixed approach. An environmental scan was performed which indicated that Indigenous informed and led initiatives demonstrated greater cultural sensitivity and effectiveness. Also, there seems to be a need for deeper understanding and incorporation of African, Caribbean, and Black sociocultural experiences into programs like PLDI. Here is a quantitative result example generated from the peer evaluation manual that shows the most frequent response on the agreement scale about activities during core training. The result leans on the favorable side, especially when we look closer at two items. 61% of the evaluators disagreed that during the activity something felt missing, topics were not addressed, or there wasn't enough information. And 82% of the evaluators strongly disagreed that some language terms used made them feel uncomfortable. The second quantitative result example comes from the post-training evaluation survey. Scanning left to right from very dissatisfied to very satisfied within the different training settings and modules, we see there is a reasonable degree of satisfaction with how inclusive the trainings felt. And the same can be said for the degree of cultural safety satisfaction looking at the figures on the right. We observe a bit more satisfaction with core and online trainings. A set of recommendations was created to continue to build PLDI as an inclusive and culturally safer environment. The recommendations for PLDI trainers and staff are to diversify the PLDI trainer pool, foster cultural sensitivity, promote cultural humility, and integrate community insights to deepen cultural understanding. For the PLDI training curriculum, expand the curriculum to include diverse cultural examples, teachings, and topics like intergenerational trauma. Incorporate protocols and rituals where appropriate to honor Indigenous ways of knowing and learning. For PLDI outreach, program offering and delivery, enhance engagement through smaller group sizes, flexible time structures, and more in-depth discussions. Strengthen outreach efforts to promote program awareness nationally and extend services to underrepresented regions. A collective statement from the advisory committee was crafted based on their individual responses when asked, "Why is the project and PLDI program important?" The statement reads, "The Culturally Safer HIV Leadership Training Project and PLDI program delivers transformative impact through dynamic support, learning, and engagement. It is essential guidance for people living with HIV to navigate their journey towards holistic well-being. We recognize the nobility and wisdom inherent in guiding others along the path of progress. The urgent need remains for continued dedication and effort in fostering culturally safer environments for all individuals affected by HIV, especially for people in ACB communities who are Indigenous or newcomers to Canada." Maya Angelou's timeless wisdom that nothing will work unless you do is echoed. For future work and next steps, it was recommended to maintain the Community Advisory Committee and establish clear roles in future projects. Continue exploring demographic influences on participation. Further investigate ACB and Indigenous community experiences in HIV contexts, and increase funding to offer customized training. Some practical next steps for the support team are to finalize and distribute an internal project report, explore future implementation of the recommendations into PLDI, and continue getting the message out about advancing inclusion and cultural safety in HIV leadership training.